We've been joined at Goldie Leigh here today by Martin Machray, who's the Regional Chief Nurse at NHS England for London. I invited Martin here in the first place because I came here a while ago with Oxleas to interview Julie, who is our nurse consultant for Barefoot Lodge, and to talk about the fact that what she was doing was pretty pioneering. And I mentioned it to Martin while we were talking about some regional mental health developments. I said, come along and have a look. And here at Goldie Leigh, we have so many interesting and fascinating teams, whether it's what's happening in Atlas House with learning disability at Tall Trees, through to the community teams that are based here, through to the inpatient services. We run the forensic services at Tilt and Mariposa Lodge and then Barefoot Lodge. It's a really good example of all the things that Oxleas brings together in Bexley and across Greenwich. You know, all these different services catering for people's physical and mental health needs.
First of all, can I say thank you for inviting me? It's been brilliant. For the last 18 months we've all been locked up, we can't get out, and then suddenly to get out in the sunshine to meet staff who've been so life-affirming, so enthusiastic about what they do. And we talked about those things that have made their jobs worthwhile, that made their life tough. And they've been through some tough times, haven't they? By gum, they've been through. But they've come out of the last few months, the last year and a half, thinking, made a difference. I've looked after people, I've saved lives, I've made a difference to the people I serve. And as a nurse or a professional, doctor or physio, whoever, but nurses today, that means such a lot, doesn't it? That you come out, you become a nurse because you want to look after people, and suddenly you find that's what you've done. And so I take away their enthusiasm, their developed practice, all of those things has been fabulous.
We've met Harriet, Laura, Pippa and Anita, and these are nurses that are specialists in long-term conditions, so respiratory care, heart failure, similar conditions. And they've been sharing their experiences about what it's been like to work as a specialist nurse over the last 16 or so months. They've been reflecting on the first phase of COVID and the second phase, and the long-term impact it's had on their service users.
One of our main roles is helping manage COPD patients in the community, and as part of the work throughout the pandemic we've been managing a home oxygen caseload, and this includes patients who've come home with post-COVID oxygen therapy. So we were just talking about the challenges with regards to that and how this was a completely different cohort of patients than our norm, and actually sort of the psychological and social impact that this has had on the patients themselves.
What we did as a team was to embrace what we had and run with it for our cardiac team. Our cardiac team comprises of the heart failure team and the cardiac rehabilitation team. We had to quickly adapt a service to meet the demands of the pandemic that we had.
With respiratory, a lot of the work has to be done face to face, so throughout the pandemic we've continued to see these patients, and actually now our new challenges are looking at actually this cohort of patients, getting them moving again, because actually we've been encouraging them to be at home, but now we need to get them sort of exercising and getting back to normal life.
We still had referrals coming in throughout the pandemic, especially in heart failure. There was very high amount of patients that were referred to the service. We formed good collaborative links with all the secondary care hospitals, because at this time they needed someone to look after patients in the community. One, because our cardiac patients are very, very at risk of viruses, and not to talk about COVID. So we were like the gatekeepers for our cardiac patients.
And, it's been a sort of really successful journey, really. It's had its challenges, but we've managed it well. So I think our plan is getting back to our normal cohort of patients and just trying to get them better managed.
It's been such a pleasure to hear from the team. They've been working incredibly hard through incredibly challenging times. For me, who's someone who's mostly office-based, it's been a special treat to come down and hear about the kind of real-life on-the-ground experience that we've heard many times anecdotally in virtual meetings. And I think for me what really struck was the kind of increased awareness and focus on that kind of interplay between physical and mental health, and the real feedback from the diabetes specialists, the respiratory specialists, about just the impact of the pandemic, not only on how they access healthcare or were unable to access healthcare initially until the teams took the offer out to them, but the impact of the fear and the anxiety on their mental health and how that interplayed with how they ended up with conditions that worsened, and that the teams were able to respond, absolutely worked their socks off, worked in new and different ways, developed stronger, better relationships across their MDTs with consultants. It's just so inspiring.
These teams are tiny. They're 2 to 3 nurses in a team, and they've taken on 60% increase in their referrals. And they've been working in incredibly creative ways and learning about managing a new condition and new ways of having oxygen prescribed for a different cohort of people that they're not used to. And they've done incredibly well. They're just so positive about how they've kept going, and they're a joy to listen to. I'm really impressed, and I'm incredibly proud of them all. They're really specialist nurses working to the top of their licences.
As Joint Chief Nurse for London, can I just say to every nurse here at Oxleas, here at Goldie Leigh, thank you for everything you've done. The city couldn't do without its nursing staff, and you have been absolutely exemplary in everything you've done. So from me, personally, thank you. Really appreciate it.